All right. So, which of the following embryologic abnormalities is most likely responsible for the development of horseshoe kidney? Okay, so we've got abnormal migration of the. Okay, so okay. The thing I'm kind of thinking about this is I don't even know if I need anything else to answer this question. If I
Sure.
know, so abnormal migration of the metanephric blastema, fusion of the metanephric blastema, incomplete division of the uteric bud, persistence of the mesonephric duct, vascular obstruction during kidney ascent. Okay, so a 30-year-old woman, she has doing an abdominal ultrasound, has mild lower abdominal pain. We reveal a horseshoe kidney. Everything else is asymptomatic, and she has normal renal function. Okay, so what I know about the horseshoe kidney is that it is a fusion of the inferior lobes of the kidney. And as the kidney like ascends embryologically, it can get caught on the inferior mesenteric artery and get kind of stuck more inferiorly in a patient. Um, Knowing that, I'm not super familiar with metanephric. Let's see.
So what does your gut say? So this is more of an embryo question. I think that you remember correctly. Just sometimes it becomes, a little bit. Of course, I'm all for um, making everything clinical, as you already know that, right? But of course, sometimes you still get questions that are or you don't, right? And so, just on a broader standpoint, let's
I,
say you get this question on your, on your actual step one exam. Are you going to spend a lot or a little time on this kind of question?
I think I know the answer.
Okay, what is
I
it?
thought about it, and I don't know what any of the other answer choices mean, but I do know that this is correct in that it is a vascular obstruction during the kidney ascent. Because, like I just said, it's a issue with the ascent of the kidneys. They get stuck on the inferior mesenteric artery, which is a vascular structure. So that's my guess.
Okay. So this and let's no, that's okay. So let's talk about this, right? So correct answer: fusion of the mesenteric blastema, horseshoe kidney congenital anomaly, a lower poles of the kidneys are fused, forming a horseshoe shape. This occurs due to an abnormal fusion of the mesenteric blastema during the embryonic phase. So you're actually correct in the fact that it gets stuck. But the reason why it's like the chicken or the egg, right? So the kidneys are not going to really get stuck if they're not fused. Do you understand what I'm trying to say? But where it gets
Yes.
stuck, you're 100% correct, right? It does get stuck, right? At the mesenteric, right? But it's not the reason. It's not. It's like what causes horseshoe kidney. You know what I'm trying to say?
Okay.
So it gets stuck down there because they fuse at the lower poles, and the reason why it's called a horseshoe kidney, as you already know, is because it looks like a horseshoe, right? And
Yes.
so if that's the case, right, and if you have your mesenteric artery right here, right, and it kind of gets stuck there, of course it's not going to ascend anymore because the horseshoe hooks onto it. You get what I'm saying?
Yes.
Okay. So yeah, so the way I would say with these kind of questions is especially on your actual test, right? You don't want to spend too much time on these, right? It's either you know it or you don't, right? When you know it's a oh man, I don't know it or I think I know it, you pick an answer and move forward because sitting here for 30 seconds versus, 20 minutes is not going to change the outcome. And especially, as you're studying too and you're learning new information, right? Try not to spend, hours, I'm making an exaggeration, right? But don't spend too much time on a singular question because actually the more volume that you can do, working through your question test taking strategies is the more you can learn. So
Okay. So I think the key to this question was being able to understand the kind of different portions of the like of the embryo, like of the embryology of the
yep,
kidney.
yep.
Okay.